Hey y'all, it's me. I just got off work and I've been in PPE all night, so just ignore the way I look. If any video that I've ever posted was to go viral, I hope that this is the one. I doubt that it will, but I just feel like my voice needs to be heard. Last night, I answered a call to go work at a facility that needed staffing help. And me and another nurse were assigned 64 positive COVID patients. It wasn't until I called the DON and pitched a fit that they sent us another nurse, which was oh so kind of them, because then that only meant that we had, about 21 patients apiece that were all positive COVID. And you're asking, Beck, how does that affect me? Guys, if you're not a nurse and you're not in healthcare, and if you're not in healthcare and you're thinking this doesn't affect you, it affects you. It affects you, and it's time that you, the general public, know what the hell is going on. I'm hearing short staffing, and that's not exactly what's happening. What's happening is that there is a lack of care. They purposely staffed that unit last night like that. It wasn't because they couldn't have got agency nurses in there. It was because they legitimately have been staffing that unit, 64 patients to 2 nurses. And it wasn't until I used the words neglect and that I felt like it was unsafe before I got help, which even that wasn't enough help. Now, this is everywhere, guys. This is everywhere that I'm going. And it's only progressively gotten worse the last 3 years. I had 64 patients last night on this unit. And this is across the board, everywhere I go. It wasn't uncommon prior to COVID that one nurse at night in a nursing home would have 30 patients. But I'm seeing nurses have 50 patients, 60 patients at night, one nurse. And that's at every facility I'm going to. Listen, if it was about short staffing, then we wouldn't have other issues. You know how many facilities I go to that don't have simple supplies? They will have a marketer take you to tour a room during normal business hours, show you how pretty it is, make you all these promises that we're going to take care of your mama. We can't take care of your mom. I had 64 patients last night. Majority of those patients were incontinent. I had no linen. There was one blanket left when I got there. And you could say, Beck, call state or don't accept the assignment. Do you know how many times I've not accepted the assignment? I'm one of the nurses that won't accept the assignment. Do you know how many times I've called state? I called state on a facility last year because they tried to give me 53 patients with no med aid and only one aide on a day shift. I called state. You know what came of it? Absolutely nothing. That facility got no tags. No tags. Now, I don't know about the hospital world because I've been working rehab and nursing facilities through the COVID and the pandemic. But what I'm seeing happen in nursing homes are these corporations are getting greedier and greedier and greedier. I did my absolute best last night. And I'm putting my neck out there telling you guys the truth. But look at the nurses in the comments. Guys, I have tons of nurses and I have a ton of nurses that follow me, a ton of aides that follow me, and I guarantee you that they'll be in the comments saying the same exact thing that I'm saying right now. The only state that has nurse to patient ratios is California. There are no other states that protect us. The ratios have gotten so bad that not only am I worried about my license and my safety at work, but I am genuinely concerned at the majority of facilities that I have been going to. I am a seasoned nurse of 10 years. I am legitimately concerned about the well-being of your family members, not just in every city I've went to. This has become common practice. Nursing homes have always had a bad reputation, but let me tell you, they have gotten so much worse, and we need the public's help. We need you guys. I could get in trouble for posting this. I fear I could. Maybe not. I don't know. But it's going to take you not coming to the nurse's station and griping at the little nurse that's trying to do her best. It's going to take you marching into the administrator's office and asking the right questions. What's the nurse to patient ratio here? How often do you get supplies? Do you have enough supplies for all your patients? It's going to take, when you find something wrong, getting on social media and writing a bad review. Social media is a powerful tool, and it's going to take some politicians stepping forward that actually want change in healthcare, because it is plummeting. We are in a downward spiral, and it's going to take people that are not in the medical world to speak out and save us.